professional goals are to practice neurology in a little bit of a general sense, but neuromuscular medicine was a big emphasis for me. This program, I obviously had some familiarity with it because I went to residency here, so I got to meet the attendings beforehand. There's a good variety of the attendings in terms of where they've trained and what they bring to the table. They practice neuromuscular medicine very differently, and they treat the same conditions differently, and so that appealed to me a lot.
We have one fellow per year. It's an ACGME-accredited program, which means a lot of one-on-one coaching, mentoring, and attention to the individual fellow's needs. We have a large group of neuromuscular providers. It's a cohesive group, but at the same time it's pretty diverse in terms of backgrounds and cultures. And they have clinical and research interests that span the entire spectrum of neuromuscular disorders. The fellows have the opportunity to learn hands-on and with supervision from faculty initially and then progressive independence as time goes by, all sorts of diagnostic procedures that one does in neuromuscular medicine, from EMG to diagnostic ultrasound, which is something more new and modern, to muscle, nerve, and skin biopsy interpretation, and if they wish, they can also learn the technique to perform it, and to autonomic studies as well. So we have all sorts of diagnostic studies for neuromuscular done in-house and interpreted in-house by qualified faculty members, and fellow has the opportunity to learn all of this.
All of the clinics are in a department where everybody's in close proximity to each other, so we very frequently ask other providers for their input, neuromuscular providers and other subspecialties as well. So it's very collegial. I've never been in a scenario where they weren't willing to help. They usually go out of their way, actually, to help, especially during the multidisciplinary clinics.
We prepare our fellows, of course, very well for their future, either as in private practice or academic medicine, whatever they choose to do, because we have a very robust group and a very strong academic program with 3 teaching institutions, the University of Minnesota, the Hennepin County Medical Center, and the VA. The fellows rotate in all 3. So that's what gives them the opportunity to see everything, all the spectrum and gamut of neuromuscular diagnostic procedures.
I would say Dr. Manasakis is also a type of a mentor for me in terms of he's always asking follow-up questions of, did I truly understand what the presentation was about, how to perform the EMG more adequately, and how to interpret the EMG and all those types of things.
We also offer fellows the opportunity outside the curriculum of our program to participate in neuromuscular medicine seminars or meetings once a year, with the cost frequently covered even by our own grants or other resources.
I would say maybe half or 60% of the schedule is fairly rigid, just to meet terms in terms of how much EMG exposure you get, how much of the MDA and ALS patients you see, but I get to tailor a lot of the other components, the other 40% or so.
So it's pretty much a 40-hour week. No overnights, no 24 hours, no weekends. You have leisure time, they can be with their families or friends, whatever. Their weekends are free. They do have a little elective time every week to pursue their interests. And what makes also the work-life balance very, very favorable is, the very active life in the Twin Cities, that they have so much things they can do in their leisure time.
In terms of work-life balance, I've never ran into a problem. They've always given me ample opportunity to take a half day here or there to do whatever I need to do, and they really enjoy working with me to figure that out.